Hi, I'm Walt Fritz. I'm the director of the Foundation's Myofascial Release Seminars, and I'm here at Oakworks today to demonstrate a technique for the rib cage. Now, in my seminars, I teach a concept called leveling the landscape of the thorax. And it can apply to a lot of different conditions, a lot of different pain type responses, or a lot of different areas that, as therapists, we see during the day. You know, I think that tightness, trigger points, spasm in the rhomboids in that scapula area is something that we're faced with every day. And you know, certainly a lot of good work out there for dealing with those knots and trigger points. But what I learned a while back was that for the most part, those trigger points, those knots just keep returning. So I started to look a little deeper. And what I noticed that the landscape of the rib cage is often a key player here. If everything is well, you've got a nice gentle curve here of the rib cage that the scapula glides over. And if the rib cage is a nice smooth curve, the scapula's got an easy path to follow. But if you've got a rib or ribs that stick up in the air, every time that scapula goes over, it's sort of hitting a pebble in the shoe, constantly being irritated. It leads to that sort of spasm or trigger point in the rhomboids or the subscapularis, a lot of the different soft tissue of the shoulder region. Now, we can massage, we can stretch, we can spray and stretch, we can exercise all this, but as long as you have that rib standing up underneath the scapula, every time it goes over, it's going to continue to irritate. So identifying those tend to be pretty easy. We want to go with a fairly deep pressure into the rib cage here and see if everything sits nice and level. Now, in Bob, there's a rib right in here that's sitting proud. It sits higher, just like what I talked about there. Now, as that scapula rides over there, I would suspect that that's where he's getting some of his pain. Is that a familiar spot right there? Yeah. And not only can I feel the rib raised, but the soft tissue, the musculature and the fascia in this area feels real matted down and webby. So again, in the way I used to treat, I would work a lot in the soft tissue, trying to free it up, trying to get it stretched out, but I really ignored that rib that was sticking out like that. So with some of the myofascial release that I teach in my seminars, I teach a combination of myofascial release and my version of soft tissue mobilization, which is a lot easier to tolerate for the patient than traditional soft tissue mobilization. So if I wanted to get into some of this gristly soft tissue, I might come in here with some of this stuff. Now, I'm not going to go full force because pretty uncomfortable, right? I could do strumming, I could do knuckles, I could do elbow if I needed to. But I tend to use a deeper sustained pressure along with the myofascial release, which I found is just as effective as getting rid of some of that real gristly tissue without so much discomfort for my patient, as well as a lot easier on me too. So what we're going to be doing here is concentrating both on that gristly tissue as well as that one rib right there that sticks up. So hand placement for this can be many different areas. It's really, you follow your intuition in terms of what you feel is the right direction. I could use cross-handed work right in here. Not only doing cross-handed of the fascia and the musculature, but going a little deeper, engaging the bony structure, okay, in a cross-handed release like that. Very common technique with myofascial release. I also like to use single-handed releases, where rib right here, I'm going to come in and I'm going to essentially put that rib back to where I want it to be. Firm but gentle pressure. I'm going to use my body weight whenever possible, not try and use my upper extremity strength, because I'm going to fatigue pretty quickly. But if I can use my body weight, I'm going to be able to last a lot longer. So I can feel that raised rib under the heel of my hand, and that's where I'm going to put my intent. And myofascial release is about patience. You're not trying to force anything. I'm waiting for the body to change rather than me trying to change the body. So I could easily spend 10 or 15 minutes, if necessary, trying to get that whole area of the rib cage freed up, right? Then we move on to this gristly tissue right here. It's almost like it's lost its fluidity. And lots of options here too. I could come in cross-handed release. I could take the medial border of the scapula, head laterally with one hand, come midline at the spine with the other hand, and just wait through that till I feel the soft tissue giving under my hands and the scapula heading out toward the shoulder. All the time I'm going back, I'm reevaluating. I want to sense the change here, okay? Over time, when I spend time with that rib that's raised up or that gristly tissue, I'm going to feel and see things change. You know, it's that rib that was sticking up shouldn't feel like that anymore. Everything should feel in a nice level plane, that very gentle curve that the rib cage should have. And that's where I know where I'm done. And the common aftermath of this technique is, boy, that trigger point, that knot, that spasm, it goes away and it doesn't come back. You know, we certainly need to look beyond here too. What created this rib or ribs popping out like they did? Often you need to go back down to the pelvis to do some work. An asymmetrical pelvis causes the spine to turn, which causes the ribs to change and morph a little bit. So this is often the secondary result of an issue down at the pelvis that we need to deal with at a later date. So I appreciate you spending time with me. Again, I'm Walt Fritz. If you want more information on my Foundations and Myofascial Release seminars, you can go to my website, www.foundationsandmfr.com. Thanks.